today's actions are a result of a vaccine safety system that is working. Our safety monitoring systems are highly sensitive, which is how the CDC could identify such a rare number of events. This pause will allow them to look further at the data and make sure that providers know how to treat this rare blood clot. All vaccines are closely monitored, and you can play a part in that, promoting their safety. Anyone experiencing possible side effects should report them to the Vaccine Adverse Event Reporting System, or VAERS. This national system collects data to look for adverse events that are unexpected or appear to happen more often than expected or have some sort of unusual pattern of occurrence. The CDC is convening a meeting of their Advisory Committee on Immunization Practices to review these cases, and the FDA will review that analysis as it is also investigating these cases. And out of abundance of caution, we will pause the use of the Johnson & Johnson vaccine until that process is complete and further recommendations are provided. So if you have an appointment for Pfizer or Moderna, please go to your vaccine appointment as planned. If you have an appointment for Johnson & Johnson, your appointment will need to be rescheduled. We'll continue to provide everyone with timely and accurate information as we learn more. COVID-19 vaccines remain the most effective way to end this pandemic by preventing the spread of COVID-19, preventing hospitalizations and death. Our goal is that everyone gets a safe vaccine. Everyone 16 and older is eligible right now to get vaccinated. These vaccines are free, and you don't need an ID or insurance. You can learn more about vaccines at yourspot.yourshot.nc.gov. And with that, we will open to your questions.
Our first question today is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the Associated Press. Thank you for the question. I know you just said that if you have a J&J appointment, you'll need to have it rescheduled, but we know some clinics are saying that you could just come in and get a different shot. Just to be clear, is there enough supply of other vaccines in the state to say anyone should come if they have a J&J appointment and just get a different vaccine? Thank you.
Thanks, Brian. So I have Amanda Fuller-Moore with me, who heads our COVID vaccine operations. But let me start by saying that our providers are making adjustments right now to how they are handling that. Many will need to be rescheduling their appointments. Some will be able to shift over to the different vaccines, the Moderna or the Pfizer. Either way, we want to make sure that our vaccine providers are communicating with everyone clearly so that they know what they're getting when they show up. Let me turn it over to Amanda Fuller-Moore.
Good afternoon. Thank you. So we do anticipate that at this point, based on our current state inventory, we have about 85,000 first doses of the Pfizer and Moderna vaccine available. We're also receiving additional first dose inventories today and tomorrow. We have, as Dr. Cohen said, asked our providers to reach out proactively to vaccine recipients who were scheduled for a Johnson & Johnson vaccine to let them know what their individual options are, if that is to reschedule if they choose to do so, or come in to receive another vaccine. But we do anticipate that we still have vaccine available for anyone that wishes to receive it.
Next question.
We have a follow-up from Brian Anderson with AP.
Thank you. And we know that vaccine hesitancy has been a major concern so far. We've heard from some experts who say, if anything, this should give people more confidence that Moderna and Pfizer are safe and effective even more than they thought, because it's gone through more rigorous testing. I guess, what's your message to people who see this as a sign that vaccines are unsafe and that they should just hold out and not get one?
Well, I think that today's announcement shows that we have a robust safety system in place and that that system is working to identify any concerns. This is a pause so that folks can look at the data, understand concerns, and make further recommendations. We also want to make sure the provider community knows how to treat these very rare events and these very unique kinds of blood clots. As I said, I think the system is working as intended, and we very much encourage those who have their Pfizer or their Moderna appointment for this week to keep those appointments, to get vaccinated as soon as possible. We know these vaccines are safe, they are effective at preventing COVID, they are effective at making sure you're not getting into the hospital, that you are not dying from this virus. So we want to make sure everyone gets vaccinated as soon as possible.
Our next question is from Maureen O'Boyle with WBTV in Charlotte.
Hi, Dr. Cohen. Thanks for taking my question. Can you reiterate to those viewers who are concerned that got the Johnson & Johnson vaccine as to who needs to be concerned? The people who've just recently had it. That's correct?
Well, thanks for that question. So if you have recently had the Johnson & Johnson vaccine and you are feeling well, you don't need to do anything right now, and you should not be concerned. What we are talking about today is an incredibly rare event, literally 1 in a million. We've seen 6 cases and in 6 million doses of Johnson & Johnson given across the country. So again, this is a very rare event. And if you've gotten Johnson & Johnson and you feel well, I have gotten Johnson & Johnson and feel well, nothing for you to be concerned about going forward. If you are someone who's had Johnson & Johnson within the last 3 weeks, and after day 3 of your vaccine, you develop a severe headache, severe abdominal pain, difficulty breathing, leg pain, then you should be calling your doctor or other healthcare provider and let them know you're having those symptoms and to let them know that you've had the Johnson & Johnson vaccine. Again, we think most folks are really just going to have the normal kinds of side effects that we're seeing after Johnson & Johnson in the first 24 or 48 hours, people feeling a little crummy, tired, soreness of their arm. Other than that, if you are feeling well after you've gotten your Johnson & Johnson vaccine, the only thing you could be doing is making sure that if something is, you are experiencing something, you can report that to the vaccine adverse reaction system, the VAERS system, and you can report that through that if you're having any other issues.
We have a follow-up from Maureen O'Boyle, WBTV.
Dr. Cohen, this announcement today almost seemed as a way to also educate healthcare providers and making sure they are treating this particular rare blood clot differently, as you mentioned. Would you agree?
Yes, thank you so much. We do agree that this is a way that we want to make sure our providers have a high degree of suspicion if they are seeing someone with a clot and with low platelets, that they should be asking about vaccine history and making sure to put these pieces together to say, hey, this blood clot is not like a typical blood clot and probably needs to be treated differently. As I said, in this case, this is a kind of blood clot that is associated with low platelets, and you don't want to be using an anticoagulant called heparin in this case. You need to be using other treatments, and so that is something we're making sure to communicate to our providers.
Our next question is from Jonah Kaplan with ABC 11.
Good afternoon, Dr. Cohen. I wondered, you got the Johnson & Johnson shot. I got the Johnson & Johnson shot. I know my answer to this question. But if you were to have an appointment tomorrow for Johnson & Johnson, knowing what you know today, would you still be getting the shot?
Well, thanks for that, Jonah. I did get the Johnson & Johnson shot within the first 24 hours. I really just felt a little bit achy and have felt well since. And that's what the vast, vast majority of folks are experiencing, which is just some temporary reaction. What we're talking about today is an incredibly, incredibly rare, literally 1 in a million type of adverse reaction. But we do want folks to know about it. I think it's our vaccine safety system working. And so if you are having those severe reactions of a severe headache after day 3, abdominal pain, leg pain, shortness of breath, please do get in touch with your provider. As of right now, vaccine administrations with Johnson & Johnson are paused. So we are not going to be vaccinating until we get further guidance from the federal government.
We have a follow-up from Jonah Kaplan, ABC 11.
Thanks very much. How concerned are you about this happening now, especially when we're finding out from some providers in some of the counties, they're starting to have more appointments opening up, and maybe as supply goes up, demand is starting to plateau?
Well, I think this is our vaccine safety system working as intended, and I think folks should feel really good about the fact that Moderna and Pfizer have been being used here in North Carolina and around the country and around the world since December. We continue to monitor for any adverse reactions to that, but the good news is that we continue to see temporary reactions to vaccines just in the first 24 to 48 hours, soreness at your arm, feeling a little crummy. So we encourage folks to get that safe and effective vaccine as soon as it's available to you. There are appointments right now for Pfizer and Moderna, and we encourage folks to get them as soon as possible.
Our next question is from Samir Nefsi with ABC 45.
Yeah, hi, thank you for taking my question. So I guess my question now, really just looking forward, of course, as we are starting to vaccinate more North Carolinians, and now we're taking away the Johnson & Johnson vaccine, is there any fear that this is going to push the state further behind when it comes to allocating those vaccines and getting those doses out?
Well, thanks for that. First, I would say that, every state in our country is in the same boat here. We are all pausing together in terms of using the Johnson & Johnson right now. And I would say the vast majority of the vaccines we've been given out are the Pfizer and Moderna vaccines, and in fact, continue to see even increases in the manufacturing of that. So, we've had a pretty robust supply now for a number of weeks, and we'll continue to see that going forward into the future. Let me see if Amanda wanted to add more. No, she likes that answer. Okay. Thank you, Samir.
Our next question is from Adam Wagner with the News and Observer.
Hi, Secretary Cohen. Thank you for taking my question. I'm just wondering about when you had the first indication that this might happen, and then sort of what the decision-making process was like this morning. Was continuing to administer J&J ever on the table?
Well, Adam, thanks for that question. And I'll turn over to Amanda because we found out through our communication channels with our federal partners very early this morning, around 7:30 in the morning. At that point, when they are making a recommendation to us, again, they are able to see data across the country that we're often not able to see just here in North Carolina. We very much want to follow the guidance of the FDA and CDC. We've done that throughout this pandemic. And so it really wasn't a conversation about should we pause. We wanted to just communicate as quickly as we could with our providers about what we know when we know it. And so again, 7:30 this morning, got that information, quickly shared some information with our vaccine providers, encouraging them to stop and pause their vaccinations with Johnson & Johnson. Thank you. Next question.
We have a follow-up from Adam Wagner.
Yeah, thank you for taking this question as well. You mentioned that there were 85,000 doses of Pfizer and Moderna in the state right now. Were those left over from last week? And if so, is it concerning that there are that many doses of those vaccines left over from the previous week?
Sure. First, I would say I want to thank our vaccinating providers for getting shots into arms quickly and equitably. And I know that because of some of the changes in allocations as well as the Easter holiday, we are still administering vaccines. But let me turn it over to Amanda Fuller-Moore.
So when we look back in our inventory, those 85,000 doses are, much of them are from last week. There tends to be a little bit carried over each week. We are working with our providers to do as much as we can do to be able to make that vaccine available in more places, to make it more accessible, to work with our providers to increase their or to decrease their no-show rate, to have folks come in for those appointments. So as Secretary Cohen said, we have also just come out of a time period of the Easter holiday, many people being out of town for spring break. So we will, of course, continue to follow that inventory to ensure that we are able to move it as quickly as possible, including moving it amongst our providers to help increase those vaccine outlets.
Our next question is from Helen Chickering with Blue Ridge Public Radio.
Thank you for taking my question. It seems the vaccine recipients who developed clots were on the younger age range, same for AstraZeneca. Could you help us understand the review process for the Johnson & Johnson vaccine that will happen going forward? And do you think this perhaps the J&J vaccine could come out with age restrictions on the other end? Thank you.
Thanks for the question. So right now, the 6 cases that were identified are in women between the ages of 18 and 48. So you're right, on the younger end. But I think we're just at the beginning of understanding a full investigation. That is what is happening right now with these cases. I know the CDC and FDA are working hand in hand. They'll be meeting with their advisory committee tomorrow to further understand this and to make sure that they are making recommendations going forward. So I don't want to speculate yet about what could come out of this. Again, an incredibly rare event, literally 1 in a million. But I think this is our vaccine safety system working to identify something that may be associated with the vaccine. Now it's our time to do the investigation, and we'll learn more over the next couple of days.
Our next question is from Sharon Van Vlieten with Spectrum News 1.
Hi, Dr. Cohen. Thank you for my question. What would be an acceptable number before the CDC or FDA halted the dissemination of the vaccine? I mean, 6 cases, would 5 have been okay? And if it hadn't grown, that would have been all right. And how do these numbers compare to severe reactions from other kinds of vaccines like flu shots or MMR or malaria or other things that people get?
Sharon, thanks for that question. And I'd have to defer your question to the FDA and CDC to understand their threshold for saying, was it 5 cases or 6 cases in terms of making that decision. I think it's a combination of what the case itself, the severity of this kind of reaction, but it's also to make sure that, as we were mentioning earlier, that our vaccine providers know that this is not a typical clot, if you will. It is a very rare form of a clot that needs a different kind of treatment. So I think the pause at this moment was twofold. One is, as I said, to investigate these cases, to understand them, but it's also to make sure that our medical community is understanding that these rare clots do require a different kind of treatment. It's not typical anticoagulation, but rather other kinds of immune-related treatments that are needed to treat this.
We have a follow-up from Sharon Van Vlieten with Spectrum.
Thank you. One follow-up is that since the number of cases or the incidence of cases seems to be more or less limited to women between the age of 18 and 48, why do you think there's been a pause on all of the vaccinations and not just that select group?
Thanks, Sharon. I think it's so that folks can identify additional cases. I think the cases we have seen have been in women who tend to be younger. I think folks want to understand, are there other cases in men in different age groups before they make any other additional recommendations. So this pause gives them the time to do that investigation and to communicate with the medical community about treatment.
Our next question is from Rose Hoban with North Carolina Health News.
Secretary Cohen, thanks so much for taking my call. You know, you're talking about that this is a pretty subtle message about how the vaccine safety system is working. You know, do you folks have a plan for combating the, there's just a formidable misinformation machine that's out there. And already, you know, they're already using this episode to gin up more fears about, you know, potential problems with the vaccines. You know, what's your plan for combating some of that misinformation?
Well, the first thing is being here today to make sure folks understand what this is and what this isn't. It is a pause. Folks are investigating further. And what it tells you is that our vaccine safety system is working. What it also says is that the Pfizer and Moderna vaccine, which we've been using for much longer than the Johnson & Johnson vaccine, we continue to use, we continue not to have an issue with. And so if you do have your appointment for Moderna or Pfizer this week, we encourage you to keep those. There are spots available. We want folks to get vaccinated as quickly as possible. As you know, we've been doing a lot of work to help folks understand the benefits of vaccine, the facts that they are safe and effective, the fact that they are now available everywhere and folks are eligible for that if you are over the age of 16. We'll continue to do education work, PSAs, working with trusted partners. I think this is where partnership is really important to make sure we're combating any misinformation. We will continue to share what we know when we know it, and so that folks can trust that myself, the department, is always giving you timely and accurate information.
We have a follow-up from Rose Hoban.
Yeah, I did a quick lookup on the blood clot rate for people taking oral contraceptive pills, and it's about 1 in 1,000 over the course of a year. You know, we're seeing this 1 in a million here. You know, like, can you and it's in pretty much the same population. Can you sort of why taking such an extreme move with this particular therapeutic when we have other therapeutics in similar populations where, blood clots are more common?
Well, thanks, Rose. I think 2 reasons why this pause is being taken. One is to see if there are other cases associated with the vaccination and making sure that we're understanding and investigating the cases that are there and understanding them better. I think the other part of this is a very different and rare type of clot that needs to be treated differently. So the clot you mentioned related to oral contraceptive is a different kind of clot with a different kind of treatment. This is more rare and actually requires, as I said, not an anticoagulant, but rather a different immune-mediated treatment. And it's really important for our medical community to understand that, as well as have a high suspicion of putting these pieces together. If you have someone who has severe headache, has clot, has low platelets, and in the context of having this vaccine, making sure you're reporting that case and we're understanding how all of these pieces fit together. Thanks.
We'll take our final question today from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. I wanted to clarify something you had said earlier, that you all had reached out to the vaccine providers, encouraging them to pause on this. So to be clear, do they have to stop administering the J&J vaccine, or do providers have any discretion whatsoever to continue administering the vaccine right now?
Similar to the guidance that came to the state from the federal government, it's not a mandate to stop vaccinating. It is a strong recommendation to pause. That is what we've recommended to our vaccine providers. Again, this is a very rare event that we are talking about, and our vaccine providers do have the wiggle room to decide that they want to keep vaccinating. We are asking folks to pause as we understand this better in the moment, and we will learn more over the next couple of days. But again, there's no mandate to stop vaccinating. It is our strong recommendation to follow the guidance of the FDA and the CDC at this moment as we learn more.
And finally, a follow-up from Michael Hyland.
Last question I wanted to ask about was going forward with the strategy in terms of how you allocate the vaccines. I know one of the benefits potentially to the Johnson & Johnson vaccine is it's easier to get to some populations, especially for people who have a difficult time scheduling the 2 doses and ensuring the follow-up happens. Is this going to do anything to affect your strategy going forward, especially if some people may be a little more reluctant to get the Johnson & Johnson vaccine?
Well, thanks, Michael. And I'll turn it over to Amanda Fuller-Moore to talk about what we're doing just this week in this moment to make sure that folks can continue to get access to vaccine. But I think you are right in saying that Johnson & Johnson was very appealing because it both had a different way of storage, so it did not need the deep freezer that some of the other vaccines needed. We were able to move it around more easily, and certainly the one and done was very appealing for populations, particularly that are moving around and maybe leaving campus, like our college students. So we want to very much relook at our strategy, but I think we'll also learn more over the next couple of days. Again, not sure yet how long the investigation will go on from the CDC and FDA. We're hopeful it will be a short period of time, so we'll understand how we're going to use the Johnson & Johnson going forward. But let me turn to Amanda Fuller-Moore just to talk a bit about what we're asking our providers to do in this moment.
Thank you. So we are right now asking providers to make the Pfizer and Moderna that they have available in as many time slots and options as is possible. We will continue our allocations this week in a similar fashion to what we used last week, specifically for our Moderna and our Pfizer. And we will also use some Moderna that we have available to open up vaccine availability to as many providers as we currently have enrolled and activated in our system. Again, we see this as a very clear sign that our safety system is working, and so we are asking our providers with that in mind to make every effort to continue vaccinating with the Pfizer and the Moderna vaccine that they have available and that's arriving today and tomorrow.
Okay, I think that's the end of our time. I'll just close by reminding folks that we continue to see viral spread across North Carolina, so take care of each other, make sure you're still wearing your mask when you are out in public, and to get your vaccine as soon as it's available to you. Thank you.